So what is fascia? The simple answer is fascia is connective tissue. It's the tissue that surrounds your muscles, your bones, your organs, your joints. If you've ever cut a chicken breast in half, you'll notice this film that kind of folds over this way, a white film. That's fascia. Fascia connects everything together. Fascia holds things in place. It also separates things. It's alive tissue. So yes, the foundation of most of my work is actually working on the fascia. I love working on fascia. I've seen so many magnificent things happen with people as I work on the fascia. For me, it seems like there's more long-term relief. It can be so drastic that the person coming off the table will say, well, they've never felt like this in such a long time. They might say, I've had this pain or dysfunction for a few months. They come off the table feeling a lot better. When the tissue's released, the symptoms tend to fade. So how does fascia cause pain and dysfunction? If you look at fascia like saran wrap, think of it as it tightening up on a muscle, the saran wrap tightening up around something. It'll put pressure in the area. It could cause things to stick to structures that are pain sensitive, such as nerves, muscles, and bone. So if the fascia is very, very stuck and it's not moving very well, what will happen is you'll get pain, you get dysfunction, a whole bunch of other symptoms that you might get related to tight fascia. So in somewhat of a similar way, fascia can cause dysfunction elsewhere in the body. So for example, you might have some tightness in your pectoral area, your chest, and you may get symptoms that are in the hand or down the arm. You might get pain in the lower back, maybe tightness in the gluteal area, your hip, but the tightness could be all the way down the entire leg. The idea is you basically want to loosen up those areas that are tight to release and relieve the areas that are in pain or dysfunctional. Fascia, as I mentioned before, is adaptable tissue. The tissue adapts too well sometimes. It can become very tight, and this is common with people with bad postures. People that sit down for prolonged periods, there tends to be more tightening of the fascia around the front of their bodies, their abdominals, their chest, and even their neck. So fascia can also become tight from lack of nutrition, such as not taking in enough fluid. It can also be caused by surgery that someone's had. Maybe there's some scarring around the area. Also, a big one is actually stress and anxiety. There are certain people that I've found over the years to be very, very susceptible to fascial tightness because they have a hard time potentially dealing with anxiety or stress. From a clinical perspective, from what I've observed, I do believe that fascial tightness can be linked to chronic pain. So if we look at, say, somebody that might have lower back pain, they may get treatment for the potential lower back issue. They might have local treatments on the lower back, but the actual issue might be actually down the leg. It could be very tight down into the foot. It could be that that's never been treated before. So what happens is that the person keeps coming in and says, you know what, I still keep getting this lower back pain. I'm not sure what's happening. It seems very tight. And what I'll find is that there's tightness all the way down the leg. I'll loosen that up first before I actually work on the back. In fact, sometimes what I'll do is I'll actually work on the fascial tightness away from the area of pain or dysfunction, and I get more from that than actually working on that local area itself. So here's something about fascia that you must, I think that'll be helpful for to teach you about how fascia behaves. Oftentimes, what I will do is if somebody is having mid-back pain, pain between the shoulder blades, is that I'll actually work on the front of their bodies. Because what happens is, potentially from bad posture, maybe they've had surgery at the front. What will happen is that their shoulders will roll forward, the fascia will become tight around the chest and abdominal area. So instead of actually working more on the mid-back or more between the shoulder blades, I'll actually work more on the front. So I will release the fascia around the chest, potentially around the abdominals, and what the person will find generally after treatment is that they feel that they can bring themselves more into an upright position. The feedback I've gotten doing this type of treatment for somebody that may have a posture that's rounded this way is that they feel a lot better. They don't feel as much resistance when they're pulling themselves back. They can actually pull their shoulder blades back this way and bring themselves into more of an upright position as opposed to feeling that they're being pulled down and forward. The short answer is yes, fascial treatments can be very painful. And again, this depends on how tight the fascia is. If it's chronic, if it's like if you've had a fascial dysfunction, if it's very tight and it's been a number of years since it's been treated or it's never been treated before, when I work on it, it will be painful. Think of it as, let's say, tissues, or think of two pieces of paper together being stuck by glue, right? So I'm trying to pry things away. I'm literally physically trying to get things to become more mobile by actually moving the tissues around. And again, the fascia is underneath the skin, so I actually work through the skin to release this tissue. And as I said, it can be painful, but it is very, very effective.